So when it comes to Kamala Harris's healthcare plan that we just discussed, obviously what she is doing is she is grifting off of Bernie's Medicare-For-All plan, calling it Medicare-For-All, but then it involves private insurers, as we said. And this is something that Bernie Sanders and the progressives and the far left took serious issue with. I know I did for sure. And Bernie Sanders and his camp, they decided to call out Kamala Harris, and they basically said this is not Medicare for all, even though you're calling it Medicare for all. So they came out and criticized her plan, and we're going to get into the details of it here. So why don't you guys check it out here. We're going to read through this a little bit, and then we'll discuss. So this is an article from Vox. It says, "You can't call this plan Medicare for all. The Bernie Sanders camp pans Kamala Harris's healthcare plan." And then the subheadline says, "Her plan, unlike Sanders's, maintains a major role for private insurance." So let's get into the body here. It says, "Progressive political Twitter is abuzz on the issue of Medicare for all ahead of the second Democratic debate this week." So this was before the debate. "With the latest back and forth spurred by Kamala Harris's recently released health care plan. Harris on Monday unveiled what exactly she calls Medicare for all, leading disagreement with Bernie Sanders to finally boil over. Harris had signed on to Sanders' Medicare for all single-payer plan in the Senate when he reintroduced the bill to much fanfare in 2017. But a new proposal she is also calling Medicare for all looks very different. This plan and these distinctions are now garnering major pushback from Sanders' high-level campaign staff. They argue that it's a circuitous, interesting word, it's a circuitous route to universal coverage designed to please industry, while not answering voters' actual demands." And this is quoting Bernie Sanders' campaign manager, Faz Shakir. It says, "Call it anything you want, but you can't call this plan Medicare for all. Folding to the interests of the health insurance industry is both bad policy and bad politics. The differences between Harris's plan and Sanders' plan come down to two main factors. First, it's phased in over 10 years versus Sanders' 4 years. And Harris's would allow private insurers to compete within the government-run program, similar to the way that Medicare Advantage currently works for adults plan. For older adults plans. Sanders' plan effectively eliminates private insurance. Sanders staffers, including Shakir and speechwriter David Sirota, quickly levied their critiques on Monday, highlighting the downsides of keeping private insurers in the healthcare system. Among the biggest critics that Medicare Advantage has received, for example, is its alleged abuse of billing practices. According to an NPR story, private insurers have overcharged Medicare by $30 billion in the past 3 years alone." So now let me read this tweet from David Sirota that kind of gets into what the article is discussing. It says, and this is quoting David Sirota's Twitter, a tweet from him, from his official Twitter. It says, "In contrast to Medicare for all, Senator Harris's healthcare proposal aims to expand Medicare Advantage-style plans run by for-profit insurance corporations. Here are things you should know about Medicare Advantage so you understand what that is really all about." And then, so in his tweet, he puts out two pictures. One picture is from, I guess, a website called Modern Healthcare. It was an article from, it's the headline for an article from 2018. It says, "Medicare Advantage plans could be denying claims to boost profits." And that's what the Human Services Department is saying. And then this is an article from NPR. It says, "Medicare Advantage plans overbill taxpayers by billions annually, records show." That's pretty damn concerning. Obviously, this is something that Kamala Harris's people know, or they just don't, or maybe they don't know, or they could just be ignoring it. Let's see. So it's continuing on with the article here. It says, "Harris's plan is being flanked by criticism from the center as well. It's being criticism from the center as well. Former Vice President Joe Biden's campaign called Harris's proposal a Bernie Sanders light Medicare for all and a refusal to be straight with the American middle class, who would have a large tax increase forced on them with this plan. Biden put forth a plan for a public option that would be open to all Americans. Okay. But supporters of Harris's plan argued that her version is a more practical means of getting to universal coverage that preserves a degree of choice that people like. Senator Harris's plan balances idealism and pragmatism, says former Obama Centers for Medicare and Medicaid Services Administrator Andy Slavitt. This is somebody that I referred to in my last article here, so I guess we're going to quote him here. We weren't able to read what he said there, but let's check out what he says here. It's, so it says, and he continues on here saying, it says in effect, we have a mandate to get everyone affordable health care and put people over profits, but we don't need to tear down the things that people have and they like in order to do it. Okay, that claim of people liking their health care, their private health care, their private insurance essentially, is bullshit. This is something we went over multiple times. I covered a poll on a segment from one of my old, one of my past podcasts, where I talked about how people would be people. They polled people, and this is fine. You don't have to take the poll. I don't like to take polls seriously, but sometimes it's important to at least point them out so people can make up their own minds. But the poll found out that something was 60%, 65%, almost 70% of people were willing to give up their private insurance companies, so their private insurance healthcare, and get the Medicare-For-All system, the government system, as long as they get to keep their doctors and their providers. So that's significant. That's a big deal. So when somebody like Andy Slavitt, who obviously is an Obama operative and a standing up for the status quo and the establishment, even though he claims to care about ending, people over profits, or ending, the healthcare companies that, put people over profits. He's just, he obviously, he's just standing for whatever Obama wants. So, and then he claims that people, you don't want to get, there's no need to tear down the things people have and they like in order to do it. You see, notice they never go into polls. This is something the mainstream media does too. They just say, oh, people love their insurance. People love their insurance. But then if you actually go into the details and be like, okay, well, would you be willing to, for example, get a Medicare-For-All system? And they'll probably answer, if I get to keep my doctor, and they do. In many cases, that's what Bernie Sanders is proposing. You get to pick your doctor. Not only do you get to pick your doctor, but you get to keep it too. So let's continue on here. It says it's very simple. There's an option for choice, says Brookings Fellow and former Obama administration healthcare advisor Kavita Patel. And then this is somebody that I think what is this? This is a guy that's working for the Center for American Progress. This is interesting because I discussed on the last podcast about how the Center for American Progress put together a Medicare-For-All, what was it called? Medicare Extra or something? Yeah, Medicare Extra plan that, they support and they're pushing, and then they're trying to get, obviously all the other Democrats to push for it as well. And then, so one of the people that works there, Topher Spiro, he tweeted, the Harris plan is essentially Medicare for all who want it, to build a smooth, natural pathway to Medicare for all. And then he follows up that tweet with, this plan guarantees universal coverage in the short term while allowing families to move over to the Medicare plan at their own pace. It says ultimately, and this is continuing on with the article, it says ultimately the difference between the two campaigns isn't just about this particular policy, it's also about the kind of change for which they're willing to advocate. Sanders' team is questioning Harris's commitment to Medicare for all, her bona fides with the left, and her willingness to prioritize industry criticism. Harris, meanwhile, has attempted to frame herself both as a progressive dedicated to pursuing ambitious plans and someone uninterested in major disruption. Yeah, big surprise. And it's quoting her here during an interview she had in New Hampshire, on a New Hampshire radio station. She says, I'm not trying to upend markets. I'm not trying to, overhaul entire systems. Sanders has been clear that he has no problem with disruption. Quoting Bernie here, it says, the current system is already disrupting and destabilizing millions of people's lives. That's a very good statement. That's a very good response. I think it seems like he was responding to her, to what she said. So the rest of the article just gets into how the role of private insurers in the future of healthcare is it's the main thing that Democrats are focusing on, and the other part is saying how Harris argues that her and Bernie had the same goal, and the experts say keeping private insurance in the system it complicates it. Yeah, I guess that's true. It definitely complicates it for sure. But if you guys want to check that out, you can take a look at that article. But but listen, you just can't trust anything that these establishment candidates say. You can't rely on it to be really getting to the core, addressing the core problems that we have, especially when it comes to something like healthcare. Healthcare is such an important thing. It's something that people are suffering with not having. So they don't have it. They're suffering without it, essentially, and this is something that, that the Democratic Party, if they want to be taken seriously, they need to be doing bold things. If they want to, if it has to disrupt the system as it being disruptive of the system, then that's what you have to do. Just like Bernie said, if anything, this system that we have right now is being disruptive for the American people, millions and millions of people in the United States, where, what is it? I don't know how many people aren't insured in this country. I mean, when Obamacare got implemented, it only insured 30 million people, right? So that only put 30 million people on insurance. Now that's the private insurance because it's mandated. It's an individual mandate, so it's obviously not public. It's not public, government-run healthcare, but it's something that was a Band-Aid. That was putting a Band-Aid on a gangrenous wound, That was fixing something with a very small solution that's not going to ultimately tackle it and, end it for good. It's something that's going to continue, it's going to continue our problems. It's going to some extent or another, probably going to perpetuate our problems too, because of the fact that the insurance companies are still involved. And, when you're having a discussion about how government should be involved, I can understand people's kind of hesitance to not wanting the government to, for example, spy on them, and to want to get involved in endless wars, and not wanting to, infringe on our rights, our free speech rights, our liberties, our, constitutional rights. That's fine. That's perfectly fine. But there are some things, as many people know. Look at the government running the fire stations. Firefighters, police, military. As I just mentioned, waging multiple wars, 8 wars that we're doing right now. That's all government-run stuff. That's government-run programs. Are you opposed to government-run programs when it comes to when it comes to the military? I don't know. But it just seems like these people, they just like government when it benefits what they want. So in the case of politicians like this, they just want government that's good for what benefits them. So if they want to go and start endless wars and unconstitutional wars and stuff, that stuff works out great for them. But when it comes to doing things that help actual people, that stuff oh no, pump your brakes. You don't want to do too much on that because it's too much government. All of a sudden it's too much government for them. But it's not too much government when it involves, all those other things, all those things that people need. And the problem is that a lot of people are just not educated on healthcare. And the conversation of healthcare has become so poisoned by right-wing misinformation. And a lot of this right-wing misinformation is stuff that Democrats fall for. And a lot of the establishment politicians that are on the in the Democratic Party, they they push and they think it's real because they want to appeal to like the so-called moderate voters. So they push the same talking points that is coming from the right wing. And honestly, a lot of it is also coming from the health insurance industry and the big pharmaceuticals and the people that are buying out. At one point, it was like probably only Republicans, and not only, but it was like a huge margin of Republicans compared to Democrats. And now it's like both parties. It's basically both parties now. And granted, it's not the entire Democratic Party. I contest that it's definitely the entirety of the Republican Party. But Democrats, it's probably, I would say, at least 60%. It's got to be 50, 60% of them, at least, if not more. I'm probably being too modest. Maybe even 70% of them. And all of the Republican Party, for sure. And that's the problem. That's the main problem. It's the money in politics that is forcing these people, allowing these people to put forth these talking points that are just complete bullshit. And the idiots and the rubes out there fall for it because they don't want to be, oh my God, I don't want, the government-run healthcare to ruin my life somehow. So it's just absurd. And don't fall for this kind of stuff. It's ridiculous. And, anybody that really wants to live a better life and a better quality of life, you need to have a government-run system that is truly going to help regular people. And if you don't, then it's just going to end up helping the super rich and the people that are already obviously they're wealthy and they're already well taken care of, and those are the people that are going to be able to get what they want, while the people that are dying from cancer and horrible, other horrible diseases and illnesses that they can't fix, and those are the ones that are going to suffer, while the rich just continue to get away with whatever they want.